I am Brian Pulasatibio from BSN 212J. So today I will be performing the Leopold'S maneuver return demonstration. So prior to conduct the procedures, I have prepared the necessary equipment which includes the pillows, the stethoscope, and the towel. So good morning, ma'am. I am Brian Pulasatibio, your student nurse for today. May I see your wristband, ma'am? Can you state your full name, ma'am, and your birth date?
I'm Jen. October 21,003.
Thank you, ma'am. How would you like to call you, ma'am?
Just called me Jen.
Okay, ma'am. So today, ma'am, we'll be doing the Leopold's maneuver. It is an easy the method which is used to determine the positions of the baby inside your uterus. So later, what I'm going to do is to feel your abdomen and to add a little pressure so that you can feel and determine the position of your baby. Will that be alright, ma'am?
Yes.
Okay, thank you. So, if it's okay to you, ma'am, that I will close the door so that so that no one from outside can disturb us.
Yes.
So, are you comfortable, ma'am?
Yes.
Okay, good.
Yeah.
So, before we begin, ma'am, I encourage you to avoid the first so that later you won't feel uncomfortable. So, position the patients of the supine with one pillow, pillows and under the head of the knees and slightly flex because if this will relieve the tensions of the abdominal muscles and placing a towel beneath of the patient's hip. To displace the uterus of the inferior vena cava and the aorta, thus preventing supine hypotensive syndrome. Okay, ma'am, you're back ma'am, I need you to lie down first and slightly flex your knee. And so that it plays with underneath your hip. Handed stands to the woman left facing the patient. So now, ma'am, let's begin. I will be exposing your abdomen. Okay, to begin with the procedure and expose only the area of examination. Now, I'm going to proceed with the first maneuver which is called fondal grip. The patients of the palpitate of the uterus fundus to determine what part of the fetus lies in the upper part of the fundus. It may be fetal head or breech. Fetal head feels hard to round, freely movables and volatables, while the breech and feels softer than nodular. So now, I am going to proceed to the second maneuver which is called umbilical grip. So, palpitates in a downward directions on the sides of the abdomen, applying a gentle dip of the pressure to determine the positions of the fetal extremities, the fetal back of the anterior shoulders, and palpitate with hands seated of the wall, going up the continuous contracture. Proceeding now to the third maneuver, which is called Pollick's grip. To do this, I'm going to place my hand over the symphysis pubis and grasp the lower uterine segments between the thumb of fingers to feel the presenting part and determine that the engagement has already occurred. So now, proceeding with the fourth maneuvers, which is called pelvic grip. This is done to confirm the findings of the third maneuvers and also determine the cephalic prominence. So if prominence is the same size of the fetal extremities, the head is flexed. But if the prominence is the same sides of the back of the head is extended. With the maneuver, we are now going to locate the fetal back again. Let's search for the fetal heart tone or for the full minute. So ma'am, we are done with the palpation of your abdomen. I'm going to listen to heartbeat of your baby. Stop na eh. Your ma'am, I'm going to cover your abdomen. abdomen now. So are you comfortable, ma'am?
Yes.
Good. After doing the procedure, I have determined that your baby is normal. Your baby is in cephalic position, which means that the head of the baby is the lower part of the uterus and it's already engaged. This is an ideal position of the baby for labor. Also, when I was listening your baby's heartbeat, I counted it at 35 beats per minute. It is normal. So, do you have any question, ma'am?
No.
Okay, thank you, ma'am. The procedure proceeds to the performing hand hygiene or hand washing and documentation of the findings. So now that's all my return demonstration about Leopold's maneuver.